Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we love talking with Lipscomb University. We're going to focus on their Master of Health Administration program. Here with us, we have Dr. Rebecca Burcham, Assistant Professor with Lipscomb University, and Dr. Lesley Tomaszewski, MHA Program Director and Associate Professor with the College of Business, both obviously with Lipscomb University. How are you two ladies doing?
Great. Thank you, Jeremy.
Great. So let's start out. Hopefully everyone knows Lipscomb University, but let's start out. Go ahead on your end, Dr. Burcham. Give us a little background on Lipscomb University overall, and then we'll dive on into the Master of Health Administration program. So give us a little background on Lipscomb University.
Perfect. Lipscomb University, go Bisons. We are a Church of Christ-based university located here in Nashville, Tennessee. We're on a beautiful campus. It's right in the middle of Nashville, essentially. And we're a small private university. We probably have roughly 4,000 to 5,000 students. And I and Dr. Tomaszewski both teach in the College of Business. We have several colleges here, but we teach in the College of Business. And I'll let Dr. Tomaszewski speak about the specific program that we offer here, the Masters of Healthcare Administration program.
Before we dive into that, give us one thing. When you talk about the culture of Lipscomb University, what's kind of your favorite piece of the equation when it comes to the culture of the school?
I've only been at Lipscomb for about 3 years as a professor. And the thing that I love about the College of Business here at Lipscomb is we are a progressive College of Business. We are nimble, and it mimics my 20 plus years in corporate America. So I feel like, academics can be a little bit stodgy sometimes, but they're not here at Lipscomb. I mean, I've got some freedom. We have the academic foundation here, but you've got that business influence, and it really impacts the culture here.
Awesome. So let's go ahead and bounce. Talk about the Master of Health Administration program. Give us a little bit of overview, and then we'll dive into a lot of the things that are going on current right now that tie back into everything that you're exploring. So give us an overview.
So the Masters of Health Administration program is this awesome program. Just a little background about me. I came from Texas A&M, and I just recently came here in August. I left one MHA program for another. And the reason why is that this program is amazing. It's a great hybrid program. So it lasts 5 semesters. So that's about 18 months. The students come, they have one class and then another class. So it's one after another. It's a hybrid program, meaning that they only come on Friday night and Saturday. The rest of the 4 weeks of the course are all asynchronous. But what's also amazing is the fact that you're in Nashville, which is a lot different than College Station, Texas. So we're able to have guest speakers come. We're able to network with the students. The students are actually able to leave their jobs and come to class. And then what's really nice is just the cream on the top, the cherry on the top is the fact that there's this integration part where the students actually go at the end of every semester to a healthcare facility. This is different than any other MHA program in the nation. So Lipscomb, just as Dr. Burcham said, is very progressive. This MHA program is definitely very progressive.
And I think you bring up a really good point. When you look at College Station, obviously small, rural, kind of, out on its own. But when you look at Nashville, top major market, healthcare industry, huge. So you have kind of this really cool combination of healthcare focused community, top 50 market that's rapidly growing. And so you can take advantage of so many unique opportunities to leverage, which ties back in. So yeah, that's a great point on your end in terms of really the advantage that Nashville brings.
Yeah.
Talk about some of the things that really make it relevant. And this will kind of lead us into legislation and telehealth and some of the things you really wanted to touch on. But talk about kind of, for both of you, bringing in, as you mentioned, the years of experience and the relevance and the corporate side. So talk about kind of the relevance of what this program really affords for individuals going through it.
So I was actually a microbiologist for several years and worked at an FDA contract laboratory. So I have that piece. And then I went to big pharma in sales, marketing, management, and spent 20 plus years in that field. And I'm not unique on the faculty here. We have other faculty members here who have served for decades at HCA. So what you'll find with our faculty, to make this very relevant, is the fact that we all have our academic pedigrees. We all hold a PhD, but we combine that academic foundation with our long corporate experience and history that all of the faculty bring to that in the MHA program. So I think that's what makes this program very unique and very relevant, because we do sit here in Nashville, which is literally the mecca of healthcare, right? So the fact that we bring that corporate experience really helps us in that world as well, because we have so many connections and so much outreach to that community. And they in turn want to contact our students, want to be involved with our students, because all of our students literally are, most all of our students are currently working in healthcare. So they're coming to this program to improve their career path. And it's just a great, I mean, really, I think the biggest benefit is the fact that there's that corporate academic relationship. And then there's the piece that's external, that Nashville's the mecca. So those three pieces combined really provide a great environment for us to do research, for us to teach, and for students to learn.
Yeah. And I think that ties back to the why, when you talk about what's in it for the students, it's the ability then to obviously have that career trajectory, the experience,
exactly.
But tying in kind of the translation, of business, healthcare, academic. So all these coming together that then give you a really rare competitive advantage. And
I'll give you a quick example. Coming up, the Nashville Business Breakfast, which is it's a Nashville area. It's not just healthcare. It's an industry, it's a multi-industry experience. So we at Lipscomb University host the Nashville Business Breakfast coming up in early February. And our keynote speaker is Tim Adams, who is the CEO of the Ascension Network here in Middle Tennessee. So he's a great opportunity for our students and our faculty to interact with industry just on our campus from a business perspective. So those types of avenues are wide open for a lot of students here at Lipscomb.
So let's dive into current events and talk about these, relevant pieces that come in for the puzzle, putting the puzzle pieces together. But one of them is state legislation regarding telemedicine reimbursement. Go ahead and start diving into the legislation.
So here in Tennessee, before COVID, about 2016, there was some legislation. And again, this is where academics get really excited, because we look at real life situations and then we research them and how does it impact the overall community. This is kind of a academic researcher's dream. We had legislation in Tennessee back in 2016 that moved reimbursement for telehealth, right? So go all the way back to the fact that since 2010, Tennessee has seen 16 of their hospitals close. 13 of them have been rural area hospitals. That's significant. That's a loss of over 600 beds, especially in the rural community. So they've really been impacted. And one of the reasons that you've seen that is because, most of the southern states have followed that. They chose not to expand under the Affordable Care Act. And so that put the strain of financial reimbursement onto the hospitals to cover. So they were really put under a lot of financial pressure here. So in 2016, there was legislation that basically said we don't really want to reimburse telehealth visits. And in 2016, the Tennessee legislature came together in a bipartisan way and alleviated that to some extent. So the payment was supposed to be equal. So if a patient went to the hospital or went to a physician's office, that payment that they paid was supposed to be the same as a telehealth visit. They extended that, I believe it's 2020, August, special session was called in August of 2020. And they furthered that to say parity in reimbursement. So Blue Cross Blue Shield, Cigna, BCBS is our largest carrier here in Tennessee with about 70% coverage. So they were basically forced at this point to have parity in reimbursement as well as payment. That really opened up the telehealth market. There are still some barriers because a lot of folks in the rural area maybe don't want to use it, but from a legislative standpoint and a payment standpoint, it really brought parity to the industry. However, something to watch in the current legislative session, that extension to parity in reimbursement expires in April 2022. So we need to watch that for this current legislative session. So that's kind of Tennessee in a nutshell. And this is the nice thing about having Lesley here as my colleague, is that she's got the same experience. She's got a lot of experience in Texas. And I'll tease this by saying that Tennessee is the #2 state for the most hospital closures. And I'll let Lesley take it away on that note.
Yeah, and unfortunately, Texas is the #1 with, just like you mentioned, since 2010. Unfortunately, in Texas, we've had over 20 hospital closures, specifically 22, and that's affected over 22 counties of the 213 counties in Texas. I've done some research in the rural areas, specifically looking at access to healthcare, and I'm not going to say it's like in Tennessee, but in Texas, we've got a lot of problems, being low literacy rates within the rural areas, people who are not tech savvy, and just an older population. Then when we put on transportation on top of that, so why would we want telemedicine? Well, the reality is that in rural Texas, hospitals are closing and ambulances are hard to find. Specifically, I'll give one example. In Cameron County, which is huge, there are 3 ambulances, and the closest hospital is about an hour away. So if something happens and those 3 ambulances are out, well, you have to wait, or you have to rely on someone to take you. So again, telehealth would be really wonderful if we were able to actually implement it. But again, how are we supposed to do that? How are we supposed to get people who might not be on board? And then we have hospitals closing, clinics closing. One idea was to have a health pod that actually was sort of an automated type of clinic where a person could actually walk into. But how do we actually get people interested in doing that when they might be tech savvy, they might be illiterate, they might not be able to have electronic funds? So those are the types of things that we grapple with actually in our courses. And I'm going to bring in the MHA course again, but we have a lot of courses that deal with these things. We have data analytics courses, we have US policy courses. So we're constantly bringing in this knowledge that Dr. Burcham talked about and that I talked about from an academic field, but we are also making sure that we have connections with people actually in industry that are dealing with this right now. We just had Andrew Kerr at our Lunch and Learn. We have every single month when our students meet, we have a person coming from industry to talk about their experiences. And he said one of the biggest problems within healthcare right now is data. And it's not, everyone's talking about big data, but just having healthcare clinics use data and gather data. That's one of the biggest issues. So here we're talking about telemedicine, but if we have an enormous amount of clinics that aren't even really using data, how could we even think about our patients going there? So again, just all of these things that students are grappling with, or maybe not even thinking about in their current jobs. The idea again is, what else is out there, and what else can we learn, and how else can we improve with our management knowledge? So Again, I'm really proud I'm here, and our MHA program it's like amazing.
Well, and how much more relevant can you be in terms of solving real world problems and really understanding the complexities? I think that's the biggest key, is that when you dive in and you look at the challenges, and between telemedicine and rural, it's everything. It's the legislation, the reimbursement, the technology and infrastructure, the access, like all of these things that you have to really step back and analyze and look at. And to be able to effectively problem solve, you really have to understand how everything is moving, and then all of those political things too that kind of go on. And so, to me, when you're talking about what this means, both for relevance, but also leadership, future leaders that are creating transformation, that's where the magic is. For each of you, give me one more thing that when you look at what this means for the community and really the nation at large, because you are creating these transformational leaders, what puts a smile on your face to see what you're able to create through the students that are going through the program?
So, and this is why we teach. I have a student, Chloe Ligon, who I teach strategic marketing and healthcare, and I teach health services management. And she graduated from our program, I believe, a year ago. And now she is in a COO training program with CMS, I believe. Is it Lesley? I believe it's CMS.
I think so, yes.
She's just one example of the exact thing that we're looking to do, is take students who have some foot in the door of healthcare in their career and then move them into this leadership position. And honestly, when you see that success from the student perspective, literally that's why I get up each morning, because I think this is my way of helping out and my way of impacting the overall health system of the state.
Yeah. And I'll use a personal example as well, in that I had a student, this is while in Texas, but was working in the Matagorda Bay area. You might be familiar with that, Jeremy. And he was thinking, how can he improve access to healthcare, specifically within radiology? There are huge wait times. So he took some ideas that we had in several of our courses, and he actually improved their wait time, in that instead of people coming in and waiting for literally hours, now in the Matagorda Bay, in their local community hospital, people are going in and being seen within 15, 20 minutes. Before, that was unheard of, but it made me, I'm not going to tell him I knew that, or I told him how to do that, but he actually figured it out himself. But he might not have thought about, all right, so let's go to the literature. Let's think about different process maps. Let's set up a control chart. He might not have thought about those things if he hadn't been in an MHA program.
Right.
Yeah, I love it. Talk about upcoming events, ways the community can help. Obviously, promoting the program is one piece of this, getting the awareness out there, but how can we help and how can we start plugging in?
Dr. Burcham already mentioned a little bit about the National Business Breakfast. Another event that we're going to have, which the community is more than welcome to come to, is a lunch and learn on March the 8th. And we're having a retired
Whitehorn. Yeah.
Yes, Jeff Whitehorn. Yeah, a retired HCA administrator come and speak. He just recently published a book on leadership treasure. So speaking to this idea of leadership, Jeremy, that's a perfect tie-in. So if you would like to come, if anyone would like to come and attend and listen to him, they're more than welcome.
Well, make sure everyone go to lipscomb.edu, learn more about the Master of Health Administration program at Lipscomb University. And Lesley, Rebecca, thank you for all you and your amazing team do. Greatly appreciate it. Thank you for coming on the show.
Thank you, Jeremy. This was great.
Yes.